You may not have thought much about what you want to do when you leave school. There are so many choices, it can become confusing. Why not think about a career in the private hospital sector? There are private hospitals and day hospitals in every state and territory of Australia, both metropolitan and regional, with more than 500 in total. So wherever you plan to live, after you've completed your studies, there's a good chance there'll be a private hospital nearby. Over 40% of all hospital admissions in Australia are to private hospitals and day hospitals. Private hospitals conduct more than 50% of all surgery and employ more than 100,000 health professional staff.
There are a lot of job opportunities in the private hospital sector for the right person, and that person could be you. Aside from doctors, nurses and personal care staff, private hospitals employ a large number of allied health personnel, such as physiotherapists, occupational therapists, dietitians, social workers, psychologists and many others, along with administrative staff to keep everything on track.
Healthcare workers are already in high demand, but as our population ages and the development of new technology leads to more and improved treatments, this demand will continue to increase. This growing and constant demand means that a career in private healthcare guarantees you job security.
Private hospitals care for patients right from birth. With recent improvements in technology, many premature babies, some born almost 4 months early, are growing up as strong and healthy as those born at full term. But kids do get sick, and hospitals can be scary places. That's why private hospitals do all they can to make it as much like home as possible. Our staff are specially trained to support the families of sick children and help them through the experience. And for kids facing a long-term hospital stay, special activities may be arranged to help curb boredom and keep up spirits.
For some patients, entry to hospital will be via the Accident and Emergency Centre. Staff working in this area of the hospital are highly trained and skilled in using the latest technology to provide life-saving care. Nurses have regular on-the-job training and competency assessment to maintain and improve their skills. Operating theatres are at the centre of the action at any hospital and feature the latest technology. Theatres must run like clockwork, so teamwork is essential. The theatre team has many players, including someone to check that all supplies for the operation are available, technicians to make sure that all instruments have been checked, counted and sterilised both before and after the operation, nursing staff to assist the surgeon and anaesthetist, the doctors involved in the operation, and recovery room nurses to monitor the patient as they come round after the procedure, and to look after them before they return to the ward. In addition to general theatres, some private hospitals have specialist units called cardiac catheterisation laboratories, or cath labs, to treat patients with complex heart or vascular conditions. There are also endoscopy suites, where high-tech cameras are used to both diagnose and treat a range of conditions. Some theatres have video links to training rooms, so less experienced staff can learn remotely as the team talks them through a procedure. Some hospitals also use simulation training to educate novice staff and help them learn new skills and techniques.
But not all hospital work involves the use of high-tech gadgets. Talking to patients and their families and providing day-to-day care is another essential part of working in a private hospital. Patients will often see several different healthcare workers in the course of their hospital stay, including their treating doctors, the nursing team, hospitality staff who make sure that any special diets are catered for, and physiotherapists to assist patients who might have a knee reconstruction or hip replacement. For patients with a terminal illness, additional services are provided such as counselling, information, education and family support.
Patients recovering from a serious accident or stroke require highly specialised care by a team of professionals to help them get back to a normal life. This may include exercise conducted under the supervision of a physiotherapist, assistance with walking and speech, or sessions in the hydrotherapy pool to strengthen their muscles. Some private hospitals also offer a range of services to patients with a mental illness, such as depression, eating disorders, post-traumatic stress, substance abuse, or schizophrenia.
But not all hospital work is clinical. Private hospitals offer a broad range of other positions, including admission clerks, accounting staff, stores and supply personnel, hospitality, maintenance, information technology, human resource management, marketing and public relations, just to name a few. If you're thinking about a career in healthcare but are worried you won't be eligible for university admission, remember that there are several entry pathways to a rewarding career in healthcare. You don't necessarily need to enter healthcare straight from school, as mature age entry is always available. If you start training as a registered nurse, you will spend some time based in a hospital. Different training models will apply depending on the university you attend and the partnership in place with the hospital providing your clinical placement. You may wish to talk to your local university to learn more about their course structure.
I was really attracted to nursing because my dad initially was a nurse, and I've got a couple of other nurses in my family, and they've always sort of talked it up, and they've really enjoyed what they do, and I just thought it's something that I could possibly look at. It's also got a lot more pathways to medicine or to paramedics or something as well if you wanted to go beyond nursing. But even though it's a female-dominated profession, it doesn't really matter what sex you are, because you can still do things and really care for patients. The assistant nursing role is fantastic. It really helps me with my study. I can look at say things in surgery, and I can apply that to what we're learning. And I'd really like to specialise in the emergency department or perhaps surgery as well. I think something that sort of offers a lot more hands-on, really working with patients, and sort of a little bit more of an adrenaline rush, and something that's really out there and happening, lots of technology going on. I'd still like to have patient contact and still be working with patients, and I think that's my passion, is working with patients and really being with them. I think that's what drew me to nursing. I think that's what will keep me there.
Once you have graduated, most private hospitals offer a range of additional training programs to help you succeed in your chosen career. New graduate programs, which may be up to 12 months duration, generally include time spent on rotation in different hospital settings, such as theatres and wards. During this period, you'll be mentored by a more senior staff member and have your skills regularly assessed so that you quickly gain confidence in your work.
The organisation that I work for runs a graduate support program for newly qualified nurses, and I was a part of that with a group of 20 other graduates, and we had an assigned facilitator who could support us and help us through when we were new nurses, which was really valuable. As well as that, we have ongoing education running frequently throughout the hospital. I think the key attribute to become a nurse manager is just determination and a knowledge that you want to be in that role, and if you have a good work ethic and you're determined to get there, then you definitely can, because there's so many opportunities within so many different areas in private healthcare that as long as you have a vision to get there, you will get the support and training that you need. I think the private healthcare sector have something to offer that perhaps a lot of other organisations or facilities can't offer, and I think that is great support and a mission to be there for our patients and try and be the best healthcare facilities we possibly can. And I think the private healthcare sector have an enormous amount of pride in delivering that high quality care. So to be a part of an organisation that believes in that is something really special.
Later, you may wish to specialise in a particular area of care, such as theatre, intensive care, or midwifery. And additional training programs are available to help you become skilled in these specialised areas of patient care.
With so many options open to you when you leave school, why choose private hospitals? Graduating nurses and allied health professionals will earn a similar salary to graduates from many other professions. Australia's population is ageing and medical treatments are continually improving, so there is an increased demand for patient care services. This means a career in private healthcare offers you job security. As a healthcare professional, you are unlikely to ever be unemployed, except by choice. You will be encouraged and supported to undertake further training to improve your skills or to specialise in a particular area of care. So there is lots of opportunity for career progression. Working in a private hospital is challenging and rewarding. Every day is different and it's unlikely you'll ever be bored. By caring for others, you will make a difference to people's lives. Patients do get sick 24/7, so shift work is a reality. But most employers will try and structure flexible rosters where possible. Australian healthcare qualifications are recognised internationally, so if you want to see the world but need to work whilst overseas, you'll be able to do so. Many of the skills you will learn are interchangeable and will be relevant to other fields of work, should you choose to change track later on. And you won't have to work alone, but in a team of caring and supportive professionals. It's not all work. Private hospitals can be fun places where long-term friendships are often made.
So, if you think you'd like to care for others while rewarding yourself, consider a career in the private hospital sector. Your school guidance officer, local universities and TAFE, or your local private hospital will be able to give you more information on this great career opportunity.